Greetings, and welcome to Lobes and Robes, How Neuroscience Can Change the World. This podcast is sponsored by the American University Center for Neuroscience and Behavior and explores the links between neuroscience and key policy questions. I'm Colin Saldana, a professor of neuroscience and the director of the Center for Neuroscience and Behavior. My co-host is Dr. Gustavo Ribeiro, Associate Professor of Law at Washington College of Law, American University. This podcast is for anyone interested in how scientific discovery can make the world a better place. Thank you for listening.
Today, we have the pleasure of having Teneille Brown. She is the James Farr Professor of Law at the Quinney College of Law at the University of Utah, where she also serves as the Associate Dean for Research and directs the Center for Law and Biomedical Sciences. She also teaches at the university's Center for Health, Ethics, Arts, and the Humanities. She's a graduate of the University of Michigan Law School and has completed several postdoc fellowships, including ones focused on law and neuroscience. Professor Brown's research is highly interdisciplinary, engaged with questions at the intersection of law, genetics, neuroscience, social psychology, philosophy, medicine, and ethics. Teneille, welcome. We are thrilled to have you. This opens up our 5th season, and thank you so much for being with us.
Yeah, thanks, Gustavo. This will be fun.
Teneille, so I'll start us. So you have written extensively about how jurors use mental state information even when they're not supposed to. What drew you to that intersection between neuroscience, psychology, and the law?
Yeah, so I think it first started back when I was a little baby fellow on the MacArthur Law and Neuroscience project back in about 2007. So I was just sitting in these rooms where philosophers and lawyers and psychologists and neuroscientists were talking about these big questions about the law and about intent and about what makes people culpable for their actions. And at one point we were talking about intention, and I remember Liz Phelps, who's a psychologist, does a lot of memory research at NYU. She was talking about the way the lawyers were talking about intent and saying, wait, we really need to come to a definition of what do we mean by intent? Because when psychologists talk about intent, it has these 5 subcomponent parts. And when lawyers are talking about it, what do you mean? And that was the first real eye-opener to me of we're not even talking the same language. And then, of course, when we were talking about hearsay exceptions and even things like excited utterance, I remember Liz saying, wait a second, you all think that people are more honest and more likely to tell the truth when they're stressed? Where does that come from? And it's that's just what we think. And she's like, well, we have evidence that suggests that's not always the case. And so I think that's where I was always interested in neuroscience. I studied biological basis of behavior in college, and I was always interested in law. But I think that's the moment when the real electricity happened of seeing wow, there's so much room for research here, because at just kind of a threshold level, we're not even speaking the same language.
That's really fascinating. And, as a psychologist myself, as soon as you started telling the story, my first reaction was, I know where this is going. And it's really fantastic.
Yeah.
Because honestly, the definitions are so different. And sometimes, do you find that these differences in definitions are oppositional or obstructive in any way?
Yeah, I think they can be. And what I've seen both with concepts like intent, which carries so much weight in the criminal law, and intent in psychology is what's often happening, or in intent through cognitive psychology and cognitive neuroscience, is that in the sciences, we recognize that a lot of these mental states or capacities really exist on a spectrum, and they're complicated and they're context specific. But in the law, we tend to want to convert these into binaries of, well, you either had intent or you didn't. And we don't have the kind of capacity with our current legal doctrine to think about these things as existing on a continuum. And so that's one way where I really do see a problem, where it's kind of a fit problem. It's also a conceptual problem. And also when we learn a lot from psychology, there are a lot of findings that are robust and have been replicated over and over again. And there's still this really slow uptake or no uptake at all in the law. So I think that's kind of fascinating to scientists, is to see, well, in science, you learn new things, you update your thinking, you update the findings, you update the data. That doesn't happen automatically in law. You can have really good data on something and say, hey, what we're doing here with eyewitness testimony, it's probably leading to a lot of wrongful convictions. And it can take decades to get the lawyers to see the need to change, because science is one of many inputs, but it's not always at the top. There can be other inputs like fairness, policy, efficiency, and so forth. So I think that's one way where the two kind of domains, like, it's kind of a fundamental difference in the way that they're
Makes total
speaking.
sense.
That's interesting. On the topic of, what the law asks us or individuals to do and what science tells us they actually do, you wrote a paper recently, published a couple of years ago, where you presented data that suggests that jurors, they use information about defendants' mental state to decide important issues for the case, like issues of foreseeability and negligence, even when they're expressly instructed not to. Do you think this behavior can be eliminated, or should just the law evolve to accommodate it rather than resist it?
Yeah, that's a great question. So this came out of my teaching torts, because I teach torts. They know that anyone who's taken a torts class knows that foreseeability carries a ton of weight in negligence law. It's the key test for duty, breach, and proximate causation. And to some extent, it even factors into damages, because the damages as a type have to be foreseeable. So everything hinges on foreseeability. But then what we tell students about, well, what does it mean for something to be foreseeable? Well, it's foreseeable. It's very circular. And so then when they're writing exams, if they're trying to figure out whether this outcome was foreseeable, like, it's very hard to take the perspective you're supposed to take, which is rewind to the time that the accident happened and right before the accident happened, and say, was this outcome foreseeable then? And it's very hard for us humans to do that, because we tend to take into account what we now know with this hindsight bias, or a curse of knowledge, where we have a really hard time remembering what we used to not know. And jurors are like that too. So once you've told them that there was this bad outcome, it's very hard for them to rewind and imagine from the defendant's perspective what they would have been capable of at that time. When I was really deconstructing foreseeability for my students, I realized that this whole thing makes no sense. Like, the definition makes no sense, that they're all blurring into each other, the different types of foreseeability. And other legal scholars have noted this. Jonathan Carty has talked about it. Many tort scholars have said foreseeability is like strawberry shortcake, I think is how they define it, and just a total vexing morass, because it kind of means whatever you want it to mean. Is it about like predictability? Is it just because the bad thing happened and so therefore they should have foreseen it? There could be a lot of moral content in there, loaded in there. So we wanted to, Francesco and I, it was a fantastic, really, really fun collaboration where he has done a lot of work on foreseeability, mostly from a developmental perspective, developmental psych perspective. But we decided to do just a really simple mock jury study. And we did find that when you tell jurors not to take into account what the defendant knew, they do it anyway. And they do it by increasing ratings of blame and negligence and damages. I don't think it's a bias. I think if I give you an example, I might make it a little more clear, but I think it's really hard to assess whether someone was careless without getting in their heads and thinking about what they perceived, what they were aware of, what they knew at the time. So like, let's say that you're riding your bike, Gustavo, and you're in a really busy city park in DC and your brakes fail. Were you careless if you run into a pedestrian or someone walking their dog and you've hurt them, and now they might want to sue you for negligence because let's say the injury was really bad? Well, we need to know a few things before we can figure out whether you were careless. Right from the bat, people might jump to the conclusion of, oh yeah, he was careless. He ran into that pedestrian. He shouldn't have been riding his bike so fast. But like, what if you had no idea that your brakes were going to fail? And what if there was absolutely no knowledge or awareness? Your brakes had never failed. You just had your bike checked. You weren't careless in the way you maintained your bike. There are all these things that we need to know before we can figure out whether you were in fact careless. And I actually argue that's not an outlier case. If any negligence case you give me, there is some mental state on the defendant's part that we need to know before we can determine whether they were careless. The example we used was just the old Von v. Menlove case of the hay that ignites. And if you know that hay can ignite when it's just sitting there, then that's careless to have this moist, decaying hay stacked in a way that could ignite. But if you don't know that, and you're like me and you've never farmed, and before you read this case, you had no idea that hay could just combust on its own, then it's not maybe careless to have stacked your hay in that way. So I really think it's not a bias. I think it's critical to know something about what the defendant could have perceived, could have been aware of, et cetera. That said, we don't know what the right way to use these mental states is. I think factoring them in some way is necessary. And I think the fact that the negligence rules tell jurors that they're not allowed to take into account the defendant's mental state, I think that's an error because, of course, how can you assess negligence without knowing that? But yeah, I think that comes from just not understanding what mental states are. So yeah, we can talk about that more too if you're curious.
In the very same paper, I was surprised to learn that using mental state is okay in criminal cases, but not in civil. Do I have that the right way around?
You've got that.
Okay. So what's the argument for ignoring?
That's a great question. It's a practical one because 150 years ago, tort scholars grappled with this. And some people argued that we should incorporate something like a mental state of carelessness into civil negligence. The argument at the time was if we do that, then negligence law is going to become just as messy and fraught as the criminal law. So there was this idea that criminal law, it's very hard for jurors to get in the heads of defendants and know whether they intended their crimes. Then let's not bring all of that mess over into negligence. Let's just keep that out of it. There's also an argument that comes from kind of the purpose between the two fields. And criminal law is much more geared towards punishment, whereas civil law is not supposed to be punitive. It's supposed to be, we're just moving money around and we're just trying to compensate people who've been wronged. And you're not being punished when you pay a fine in negligence. And so because it's designed to not be punishment in civil law, then there was a thinking that we don't need to take into account your mental states.
It sounds like a quagmire, actually. It's difficult.
Totally. Yeah. Well, on the one hand, defendants who are asked to pay, hundreds of thousands of dollars in fines, if you call it damages or you call it a fine, from their perspective, it feels like punishment, right? Like they think it's punishment. So subjectively, and then also morality plays a role in negligence, even if we say it shouldn't. It absolutely does. And there have been a ton of really interesting studies showing the effect of hindsight bias and morality on negligence assessment. So it can affect proximate causation, the work of Scott Shapiro and Joshua Knobe that have shown that if you add morality into the behavior, that will affect the way people even assess causation. And so it's not the case that we can separate out mental states. People are always inferring mental states. Jurors do it in civil cases. They do it in criminal cases. They're assessed. And in fact, that's their job, right? Like Gustavo knows this with evidence. That's what jurors are supposed to do.
Right.
They're supposed to be making inferences about mental state to say, do I believe this witness? Do I think they're telling the truth? And so the law is just really confused about what role mental state inferences play, because they're the core function of the jury, and yet the jury's not supposed to do it in all of these different domains.
Right. Given that is the an important role of the jury, do you think neuroscience research on predictive processing and other areas can ever inform how courts and maybe jurors in particular, how they define and interpret and apply the idea of what a reasonable person can foresee?
Maybe. I've thought about this a lot is there some way to show group data on maybe how lousy we all are at foresight? Because we're all really bad at it. And so actually what's interesting is some people, like with anxiety disorders, are actually better at foresight than the rest of us. But then they have more false positives of predicting bad things that are going to happen. But they're also more accurate. But most of us are pretty bad at it. We look back and say, oh yeah, that should have been predicted. But when you actually ask us to anticipate what's happening in the future, we're really, really bad at it.
Right.
I think some kind of neuroscience data, or maybe not even neuroscience data, but just social behavioral data showing how bad we are at predicting outcomes in real time might be helpful to kind of re-anchor the jurors into the perspective, kind of the ex-ante perspective. Because the problem, of course, is when you're a jury in a trial, there's been an accident, a car accident at an intersection. You now have the benefit of seeing kind of a bird's eye view. Maybe there's drone footage of the intersection. They've recreated the way the cars were coming and the speed they were coming. Well, but if you're the driver at the time who causes the accident, you don't have that perspective. You may have sun in your eyes. You may have had some baby crying in the back of your car. I mean, there's just all of these things that are affecting your attention, your perception. And so I do worry that jurors after the fact are kind of imposing this perfect perception, perfect awareness, perfect knowledge onto defendants that it's not reasonable to expect. And so there might be some way to try to show them how imperfect we all are, to kind of like maybe like we do with eyewitness testimony, providing jury instructions to help people realize how fallible that is. And that has had some benefit. The problem, of course, is once you go down this road, then you have to be giving instructions for all kinds of things that we get wrong because we overestimate and underestimate all sorts of things. And so then how long should that list of jury instructions be? It could go on and on.
As you were answering the previous question, all I could think of, I was thinking about two great contributions in psychology, one from Elizabeth Loftus, as you mentioned, eyewitness testimony, and the other one from Daniel Kahneman, who, along with his collaborator, showed that unlike economists thought, we don't make these careful, rational decisions about investments or things like that, but rather when we do so, when we try to be rational, we make many, many, many more errors compared to when we just go with our guts, quote unquote. The question that came up for me is, in both those cases, has neuroscience pointed out anything positive that could help the law? All I'm hearing is, oh, you can't expect us to do this, or people don't do that. It sort of takes away from what the law wants people to do.
That's a great question. I do think there are some areas where it's not so gray, where there have been exciting contributions from neuroscience, but they tend to be not so much in the population kind of fMRI or EEG type of studies, but more in the individual structural stuff, like someone who had a stroke, someone who's had a tumor, and then seeing the way the tumor or the stroke impacts their behavior, maybe in some pretty fundamental ways. So at an individual level, I do think there's a lot of space for neuroscience to inform competency proceedings in criminal law. And even at the population level, maybe making policy. Like we could make policy, as Emily Murphy has suggested in her really awesome work on collective cognitive capital. We could make policy decisions based on neuroscience findings and thinking about the brain in kind of a population mental health way. And there, like the cost of getting it wrong is much lower because we're not making an inference about an individual and the consequences are not someone's going to jail or potentially losing their life. And so I do think that the value of neuroscience really depends on the use and kind of the cost of getting it wrong.
That's a great segue to a question that I always have when I think about some of this issue, which is we have some findings from science, from a scientific study that are often, modest but reliable or weak but significant. And there's always a question of how much should expect or hope for to justify a change in the law or legal practice, right? So it turns out that a lot of our law and legal practice are based on empirical assumptions that often go untested. And if we have some evidence, even if it's, weak support or modest support, that the assumption is actually a different one or is wrong, to what extent that should change the law or legal practices? How much should we expect from scientists to change our practices?
Yeah, that's another really insightful question because I think it often just comes down to politics of like, who is the person who's bringing the science and what is the purpose they're using for it? I've written about this thing called the biolegal mismatch, which is where, like I said, biology exists on a spectrum, but the law wants to convert all of these things to black and white answers of guilty, innocent, voluntary, not, dead, alive. And so sometimes they use the science in a very disingenuous way, in a very politically motivated way. And it's just like a finding. It's one paper or it's one lab that has found this. And it doesn't have great ecological validity. It's never been tested in the real world. But you are motivated to try to anchor your political argument in science. Then I see this as a very sinister use of science where it's being used as window dressing to really make a normative argument. But I have a pretty high bar for when I think that the science is ready to lead to reform. Absolutely. In one of our studies, you mentioned the study of mock jurors looking at foreseeability assessments. We had some findings that were really significant, their use of knowledge and how that impacted their ratings of negligence. But we also had some findings, like you'd mentioned earlier, the jury instructions, when we instructed jurors not to use the mental state information, they still did. And that finding, that it was reduced, but it was still, they still were using it, but that was a very modest finding. But even that really kind of robust finding of mock jurors using the mental state information, that's still just one study. And so I wouldn't think that even with that study, even with significant, maybe even large, statistically significant findings, that's still just one study with one group of participants, with one, like maybe 4 different vignettes. So I would think you need quite a bit of replication before you should be arguing for legal change. But we do have some psychological findings that have been replicated, for decades,
Right.
and that have been demonstrated in multiple cohorts and across cultures. And so I think those kinds of findings are the kinds that if we want to be changing legal rules, that we want to be really demanding a lot. But of course, that's me, right? And that's my take. But these changes often are vetted through a political process. And so politicians are quite often using super thin findings of one lab to, we saw this in the mifepristone cases where they were arguing that the abortion pill was unsafe and they relied on a study that had since been retracted. What they were arguing was unsafe were just really normal side effects. People were bleeding, they went to the ER, they were sent home, but like the bleeding is to be expected, and doctors would say that's not an adverse outcome, that's a predictable outcome. But like that, the science was being used in that Supreme Court case and those arguments in the Fifth Circuit to say that this drug should be pulled from FDA approval. And I know a lot of scientists were saying, that's bananas. How could they use that study that was retracted that nobody thought was even a good study to begin with? But that's the way it works in the kind of legal/political process.
That's amazing to hear.
Fascinating.
It really is. So I know the case you were talking about, Teneille, and I remember being, like you said, gobsmacked. How can somebody try to use data from a retracted paper as evidence? Are there not punitive damages for this? I mean, so the lawyer can do this. It's perfectly okay to know that a paper was retracted, but still argue with its data. Wow.
That's right.
It is.
I know it's really depressing, right? Because we're talking about neuroscience, and it's like all of these people are really ethical people and in good faith. They're doing great research, and it's just a matter of maybe having some modest findings and when does it tip the scales. But that's a case where it's not a good faith actor, and they're using research that was not produced in good faith and then relying on it not in good faith. There's no kind of consequence for that. In fact, that's considered zealous advocacy, and they may even be encouraged to do that. But there's certainly no professional ethical consequences. There's no disciplinary proceedings or anything like that for that sort of behavior. And some of it comes out of ignorance. Like sometimes people they don't know how to vet studies, so they pull a study from Google Scholar and they're like, this looks great. And then they run with it. And other times it is more like organized and it's like really cherry picking deliberately to make a political point. But that's the problem is when you have that as the baseline, then everything we're talking about on the margins of tweaking the law really feels a bit like rosy glass kind of optimistic,
right?
Because we're not operating in a political vacuum. And even something that feels apolitical, like the rules of evidence, are in fact also filtered through a committee that is pretty political and pretty slanted towards pro-prosecution. It's humbling in the sense of like the potential impact of getting any of these findings across and getting some kind of uptake.
That is a little depressing.
But it's not depressing everywhere. I should say that really at the state level, I'm on our state's evidence advisory committee, and we are proposing changes to the rules. And that committee, I'm in a very deeply red state, but the Supreme Court is very interested in getting it right and looking to the data and then even putting things in the rules to say we should be in several years kind of revisiting the data on this to see when we gave our instruction for eyewitness testimony and instructing jurors on the fallibility of it. They said, you know what, recognizing that these data change, we should come back and revisit this in like a decade and see what the social science data say then. And I think that's an example of there are some state courts that are really trying to follow the data. And especially in evidence, because that's all evidence is trying to guide decision-making, right? With some folk assumption about how people do it. And no matter what your goals are, no matter what your kind of normative commitments are, if your theory of how people make decisions is wrong, then you're not going to get to your normative goals. And so I think psychology and the marriage of kind of psychology and cognitive psychology and evidence is a really important one because there's just so many untested assumptions about how we think jurors and judges make decisions.
That's amazing. See, Colin, there's hope.
I was thinking.
There's hope.
Exactly.
You just have to go to the States.
What I was thinking.
Well, and the good news slash bad news is most of the cases that come forward, and especially in the criminal law, are state cases. They're not federal cases. The federal cases tend to be drug trafficking cases, but the large majority of criminal law cases are in state courts. So the Supreme Court just doesn't have as much power when it comes to interpreting evidence rules there.
Speaking of the Supreme Court and changing gears a little bit, now, Teneille, you recently led a group of law professors in signing off an amicus brief on the Supreme Court in this recent fascinating case, Diaz versus United States. First of all, it's a great just use of scholarship into advocacy that was just truly remarkable and extremely well done. I actually teach that case in my evidence class, and I signed the brief that you co-wrote, which is a fantastic piece of scholarship and advocacy. In that piece, you and others, you emphasize how mental state experts offer quote-unquote framework or group-level evidence, not individualized diagnosis. Can you help us unpack that distinction for listeners and start that discussion? Because it's a fascinating one.
Yeah, sure. So I think of this as just ordinary issue of what we call conditional relevance in evidence law. So the expert offers evidence, maybe profile evidence, psychological evidence, what we would call framework evidence about a group of people. So what they would say is, hey, I am a psychologist, and I'm going to speak to you about how most people with schizophrenia tend to think or behave in these situations. Or I'm going to tell you how most people with opioid use disorder may behave or think. And of course, it's not going to be perfect because there's a lot of variability within those groups. But they might say, this is how people with this disorder tend to think, and this is how their thinking tends to be impaired. So they're just taking off-the-shelf data about a group of people and offering it to the jury. Well, that's not relevant unless you connect the dots and say, and also this defendant has schizophrenia, and also this defendant has opioid use disorder. But that's the jury's job to connect those dots. That's a factual determination that the jury gets to decide. And I think the Ketanji Brown Jackson, Justice Jackson, to some extent Justice Alito, they understood that you're preserving the inference for the jury, but the rest of them didn't seem to get that. They really were struggling to just understand that when this rule of evidence, Rule 704, it developed in the wake of the Hinckley trial where everyone was perceiving him to get off because of his schizophrenia. And there were competing experts where one said he didn't have the capacity to form the intent to kill the president, and the other expert said he did. And so they established this rule because they didn't like the idea of experts telling the jury whether a criminal defendant did or did not have a particular mental state. And they didn't say mens rea, they said mental state, so it's much more broad than just, purposeful knowledge, recklessness, etc.
Right.
So our brief was really trying to show how you need to allow experts to speak to that framework evidence because it's not, in this case, it helps the prosecution. I could talk about the case facts if you're interested. But in other cases, it might be the criminal defendant who really needs evidence of their psychiatric disorder put before the jury.
Right.
And if you don't allow that, then things like if a criminal defendant was behaving erratically, but it was because of a mental disorder, or something like battered women syndrome, where the average juror might punish a woman for sticking around and saying, why would you stay with this man if he's abusing you? We don't believe you. An expert who could come and talk about, well, this is how women who are battered tend to behave, and this is why they tend to stay around and endure the cycles of abuse. That helps the jury understand a group of people for whom they have no experience or no exposure. So I think framework evidence is incredibly useful, and this was what we put in our brief, when the jury just doesn't have a lot of experience with this group of people. And in that case, it was drug traffickers. If you don't know how drug traffickers work, sometimes an expert can help you understand how they tend to operate. And we argued that doesn't take anything away from the jury because the jury still has to make that ultimate conclusion of, is this person part of a drug trafficking ring? Okay, you've told me lots about how drug trafficking organizations work, but I don't buy that this person's a member of that. And they can always preserve that inference and determination. And so we argued it didn't violate Rule 704. But that's really what it came down to is, can an expert give you data about a group of people? Is that useful to the jury in making many of their decisions?
That's fascinating. Now, this is related to the so-called group to individual inference, right? So G to Y that Fagmans and others have explored in their work. That is how we move from general findings about groups to individual judgments about specific defendant. Do you think neuroscience or science in general will ever help us bridge that gap, or is that something inherent in reasoning or statistics that the law just have to get used to it and manage?
Yeah, that's a great question too. So David Fagman has written a lot about this, both in the criminal law and the civil law.
Right.
So like the idea there is you could have a chemical and you could say this chemical is known from an epidemiological perspective to cause cancer. We know that. We've tested it in rats and humans. It's a known carcinogen. Did it cause this particular plaintiff's cancer? Well, that's a different question because obviously cancer can be caused by lots of things. It could be caused by that chemical or lots of other chemicals. It could be their genetic predisposition, et cetera. And so I don't know that neuroscience is necessarily going to solve that or bridge that, but I do think you could pair really strong epidemiological data on kind of general causation, but then you're going to need much more evidence from the individual to rule out other causes. Like, is there some biomarker that makes this cancer caused by this chemical different from the same general type of lung cancer, but when it's caused by a different chemical? I think that's why asbestos litigation was such a moneymaker for so many law firms, because it's a signature disease where you can say asbestos causes this kind of mesothelioma, and we can connect the dots from the group to the individual. But unfortunately, like most of the chemicals that are out there in the world, it's something like 80,000 chemicals that have never been tested at all for safety or efficacy that are in the chairs we sit on and the desks we write on. And so getting that kind of group to individual data and then ruling out other causes from the individual's perspective, that's the real $1 million issue. I don't think it's neuroscience alone that's going to bridge that, though. But I do think if we could get better biomarker, like tumor biomarker data, because it's really, really prevalent in kind of cancer, mass, multi-district litigation stuff. But also, it could be better on the other side with drawing inferences about, say, how people with autism tend to think differently. Maybe we'll discover that there are subdiagnoses of autism and it's not one thing. But if you really get concrete on what that diagnosis is, you might be able to do some kind of imaging of an individual and then make some, not certain, but, predictive determinations about whether that person was capable of certain kinds of things. I think it's going to be much more useful if we think about individual decision-making in the civil context, where the costs of getting it wrong are a lot lower, in like administrative hearings where we're trying to decide if someone has a disability, because then again, it's not a matter of life or death and the costs of getting it wrong are significant, but lower. I still worry in the criminal law context of people using brain imaging, functional brain imaging, as the end-all be-all. Like, it's a useful piece of information. And if we could introduce it and knew that jurors were kind of putting it in context and not having it be the piece of evidence to speak to whether someone had capacity to form intent, but instead just saying it's some evidence, like, right, it's evidence like their neighbor's testimony is evidence. There's a place for that, even going from group to individual, because it has some probative value. It's just maybe not that much. Right. I think the concern is that people will give it too much probative value.
Right.
I immediately thought about some conditions, or I should say, there are some neurological conditions that may provide some individualized insights. I'm thinking about traumatic brain injuries or strokes. If we know where the damage is and we know what kind of pathways are going through that area, does that still remain framework evidence, or now are we actually looking at the defendant's mental state?
Yeah, that's great. I would consider that to just be individual evidence. I think you're absolutely right. When you're not relying on pattern classifiers and group data and averaging, but instead you're just saying this person has a lesion in their dorsal medial prefrontal cortex, and this lesion is making it very difficult for them to make decisions, or this person has a tumor in their prefrontal cortex, or they have like frontotemporal dementia, or they've had a seizure disorder that is blocked out. They had a stroke from a seizure and it's blocked out this region of their brain. I think that, that would be individualized evidence that's structural. And so you're not relying on group data. You're just saying this person has this deficit, and you could demonstrate it by asking this person to do tasks. And then you could show that they have behavioral deficits based on, and then the whole point, right? This is what Steve Morse says, the attribution error that occurs here is just to say that something is caused in the brain isn't to excuse it, because everything is caused in the brain. But if you could show that it was caused by a tumor or a structural change, then I think people do see individuals as not morally responsible for those kinds of structural changes from a car accident or, traumatic brain injury. So yeah, I think that kind of evidence is already coming in the courts. I think it's totally acceptable. I think it should be coming in. It can come in to speak to people's pain. It can come in to speak to people's mental capacity and how maybe just mitigation evidence of it's harder for me to conform my actions to the law's expectations because of this stroke or because of this structural lesion. So yeah, I see a huge difference between the use in present day of the use of kind of functional neuroimaging versus structural stuff. You still don't want to overstate, right? Like someone could have a benign tumor that has never impacted them and they didn't even know they had it. And then just through routine imaging in their criminal case development, they say, oh, you have this little tumor that you didn't even know you had. So there are ways you could still use a structural image. It could be like an incidental finding, right? And like clinically completely non-significant. But so people could still abuse it. But I mean, there are ways for the courts to suss that out and to say like, well, how is this affecting your behavior? Are you seeing any behavioral changes? And there's always concerns of malingering in the law. But I think those are just different in kind than the kind of using fMRI and correlations where we think that when there's a relative activation in this part of the brain that it means X. And sometimes we have pretty good data that it means X, but it could also mean X or Y, right? Like, because there's limited real estate in the brain. And so each little section does several things. It doesn't just do one thing. But I do think that distinction between structural and functional imaging is an important one for the law.
That's fascinating.
So your work also explores how neuroscience challenges the legal definition of something as fundamental as death. You point out that brain dead, quote unquote, individuals can perform several biological functions that require neural activity. What would your suggestions be about where to draw the line between, let's say, basic bodily function and executive reasoning? Is there any way of drawing a line there?
Yeah, I mean, I think there is. And like the UK uses the brainstem definition of death. Their definition of legal death means that your brainstem is not functioning and it's not linked to higher order kind of executive reasoning, moral decision making. It's just, can you breathe on your own? Are you able to kind of regulate your wake and sleep cycles? And that sort of basic neuroendocrine kind of pituitary functioning isn't happening. That's interesting because a lot of people, if you just ask lay people, what do you think it means to be alive? And what are the kind of essential components of being either morally/legally alive? What do you think the law should care about? Most lay people would say it's the executive reasoning. It's the kind of moral decision making. It's the higher order thinking that makes us truly alive. It's the consciousness. No one has adopted that higher order. It's not, even in the UK, it's technically not, you don't need the higher order thinking or lack of higher order thinking. They haven't framed it in that way deliberately because that starts to get into a lot of potentially ableist line drawing about people who have severe cognitive disabilities and are they not fully human because they are not someone who has, say, frontal temporal dementia. Are they not fully human? Are they legally dead? And it's much harder to draw the line in terms of which executive functions and which moral functions are relevant. But that is what most lay people think it's intuitively, that's what they think is kind of the most important thing, is their capacity for moral decision making. But in the UK, they use the brainstem, and it's just biological. Is your brainstem functioning or not? And if you've lost the ability to regulate temperature and breathe on your own, you're dead. It's not about whether you have this higher order thinking. In the US, it has to be the entire brain, and it needs to be a complete cessation of the entire brain function. And so what got me is I'm on the ethics committee at the hospital, and I'm on this Center for Medical Health Ethics and Humanities. And neurologists were coming and saying, we do not demand what the law requires. And people are being declared brain dead who do not have complete cessation of all brain function. There was this famous case from the early 2000s, the Jahid McMath case. She was a I believe, an 8-year-old girl who went in for just a routine tonsillectomy, and they lost her airway, and she was then declared brain dead at Oakland Children's Hospital. Yeah, it was an awful case, very traumatic. And it's not like, it's not without notice that this was a woman, like a young girl of color, a child. And this is when unfortunately, this is when a lot of these cases bubble up and enter the court. There is a lot of medical mistrust.
Right.
There's a lot of feelings of you didn't do everything you could. So there was a lot of medical mistrust here, with the parents feeling like the hospital and the physicians were way too quick to declare Jahi brain dead. So they didn't buy it. They didn't buy the brain death diagnosis. Lots of other experts came in, neurologists, neuroscientists. Multiple people were doing assessments on Jahi, and most of them said she met criteria for brain death. But then she still had her period, and her hair kept growing. And that's when the family was also saying, we're noticing some twitches that they said they thought were purposeful. And people reviewed the video footage to say, do we think that her movements are purposeful? And it was a totally drawn out case, a really tragic case. She ended up getting a Catholic religious group to fund her to be able to be flown to New Jersey, because she was legally dead in California, but she was not legally dead in New Jersey.
Oh my goodness.
I know, right? It's like, how can that be the case? How could you be legally dead in New York and California, but not in New Jersey? And so that's just when I thought, this is really interesting. And some people have argued that brain death is a legal fiction. I don't think it's a legal fiction. I think it's just something that's difficult to measure. And what's happened is, because it's difficult, and you have all these artifacts where people could have preserved brain function in areas that are very hard to get to and very hard to measure, you could have people who aren't necessarily acting in bad faith. They really think they've done all of the assessments, they've done the apnea test, they've checked all of the different tests for brain death, and she's showing no signs of brain activity. But she had this very minimal reserve of endocrine function that allowed her to continue, spiking a fever, having a period, and growing hair. The requirement, even in California, is that you should have had zero neuroendocrine function. So she shouldn't have been declared brain dead if she had any brain function. So and then neurologists were saying, well, we don't know what to do because we can't measure that perfectly, and the law requires us to, so we just don't follow the law.
I'm very glad you brought up the UK information about brainstem, because I remember thinking, if you think about the evolution of the brain, the organisms, I should say, vertebrates who have been on this planet far longer than we have, we basically see that executive function, reasoning, the cortex, things like this, are much more recent evolutionary developments in the formation of the brain than in fish, for example. But I'm relieved to hear that somebody is taking that into account, because yes, like you said, breathing, toxicity, these are control centers that are in the brainstem, and they are so fundamental to life. It does make making a decision about brain dead very, 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 very specific.
Right. And really complicated, because it's kind of pushing the limits of, we have all of these new tools like EEG, and we have new tests, and we can rule out things like metabolic issues, hypothermia, drug toxicity, but it's still not perfect, right? So it's in some ways, this is a sideways gift of progress, because 100 years ago, these people would be dead, because it's all the common pathway of, if you herniated your brain, at some point you will stop breathing, and then you will have cardiac death too. But because we developed the mechanical ventilation and the ECMO, we can keep your heart and lungs pumping, and we can do that artificially for you, even when your brain is not working. And so then what do you do? It really is a conundrum, because you can't, I guess in theory, you could stay on a ventilator for 50 years as long as you didn't get an infection and you had insurance and so people don't tend to be very healthy. They get a lot of infections, and they get a lot of bed sores, and there are a lot of other things that come from that. But in theory, you could, but should the law then have to accommodate that? Anytime you have a severe traumatic brain injury from, say, a car accident, do we need to keep you on a mechanical ventilator for 80 years? It's real. That's a tricky question, right? That's an incredibly significant legal question. When would we do that, and when would we not do that? And would we accommodate different people's religious beliefs about when life ends? And I think it just gets into a whole a whole set of questions that the law is not incredibly excited to be, digging into.
Oh, that's interesting. Yeah, no, that's all extremely complicated, though. Different ways law deals with death in different aspects, both in terms of medical requirements or, property requirements and liability and others.
Yeah, so much hinges on it.
Right.
And it's like, it's not a black and white thing. And in some cases, it might be better to just acknowledge that, like show a little humility about our diagnosis, because this happens in medicine all the time where physicians are kind of trying on diagnoses and saying, we think you have this kind of cancer. We're going to treat it. We'll see how you respond. Then we might need to try a different one. But somehow when it comes to brain death, I think because the public is so skeptical about it. And because, let's be real, like the media coverage of brain death is just abysmal. Like they say things all the time about people being kept alive on life support, but they're brain dead. It's like, well, then they're not alive. So you're not using life support and they're not being kept alive if they're dead. And so there's just a lot. I think people confuse coma with brain death all the time. And they talk about people spontaneously coming out of their brain death. It's like, no, that doesn't happen. Like even in the case of Jaheem McMath and others where the brain death diagnosis may have been mistaken, they're not coming out of it and like talking and walking. Like that doesn't happen. Like these are people who never regained consciousness. If they've really performed the neurological tests correctly, these are not people who are going to just like be revived and go back to normal. It's just the case that they might still be able to stay on a ventilator for quite a while and their family feels like they could talk to them and that's meaningful for them. But the media screws up brain death all the time. They talk about brain death when what they mean is coma. So patients are incredibly distrusting of the diagnosis. They don't think it's real. It's also new, so it didn't exist 100 years ago. So that feels like, well, how can we have a new definition of death? Yeah. And so doctors, instead of acknowledging that ambiguity and uncertainty and saying, hey, we can't diagnose this perfectly, they come in really hot and are like, we know for certain that this person is brain dead. We've done 2 tests as we're required to do. They're dead. And like the family just doesn't respond well to that. And then they get another outside physician to look at it. And the outside physician says, well, actually, I'm seeing some like signs of some very deep activity, or there may be some reservoirs that are coming back online after the injury. And they seem to be regulating their temperature on their own. And so then that just undermines the original message, and then they don't trust anybody. And so it's really an issue of trust. And I don't think it helps us to come in with this black and white thinking of like, they're definitely dead, if that's not the way the family's experiencing it, because they're touching their skin and it's warm and their hair is growing. And I mean, can't imagine a child who is declared brain dead but then gets their period, right? Like that would just fly in the face.
Yeah. It's like an episode of Law and Order meets House.
Yes.
Yeah, exactly. Yeah.
Very good analogy.
Yeah. Well, and people do it with bad faith. That has happened. So meantime, while we're on the one side trying to talk about how to refine the Declaration of Death Act to make it a little more nuanced, then you've got physicians in Tennessee who are like giving patients sedatives and then declaring them brain dead because they're not moving. Well, you can't. If you've given someone sedatives, they're not brain dead. And then doing things like trying to harvest their organs when it's someone who had just had an acute drug toxicity. So those stories absolutely undermine people's faith in organ donation and brain death. Right. And you can't really talk about brain death without talking about organ donation because that is the number one source of organs. So people are very suspicious of expanding the definition of brain death so that then you could just, be too quick to take people's organs. Even though I think there are a lot of regulations to make sure that doesn't happen often, it can happen. And, a family member would say if it just happens once, that's one too many times.
This part of the conversation has been so interesting, fascinating, and depressing, but in the interest and dark,
right?
But I can see where the intellectual impetus comes from. These are absolutely fascinating questions. In the interest of time, however, I think we should try and wrap up. So maybe just a couple of questions looking forward. Is there a misconception about neuroscience and law that you most want to correct?
It's maybe a misconception really on the law side, just because that's where I sit. And I'd be curious to hear what you all think about the kind of from the perspective of more neuroscientists and psychologists. But one big misconception that you see throughout the law is this sharp distinction between mental states and feelings, or actions and mental states. So the law really has this strong, sharp distinction between actus reus and mens rea. And it's not just in the criminal law, it's in negligence law, it's throughout, it's in constitutional law concepts, where we think that this Cartesian dualism crops up, and we really think that there is a big distinction between someone's mental states and their behavior. And this comes up in evidence, in the character evidence rules, where we think you can tell jurors about what someone was intending. That says nothing about what they did. There are just so many examples of that, where the law really puts so much significance on the distinction between mental states and actions. And in practice, those two are intimately interconnected and sometimes have a bidirectional relationship, where when you hear about someone's mental states, you're automatically predicting how they behaved. And when you hear about how they behaved, you're automatically predicting their mental states. And the idea that we could put a cleaver between the two is just, in some cases, it's impossible, because in some cases, the act indicates a certain mental state that you cannot separate out. So there's a big case in Utah involving a man who was charged with masturbating in public in front of a child. Well, if you are actually masturbating in public, the intent is kind of assumed as part of the action, because you don't do that accidentally. You don't do that in a way that's not nefarious. And so there are a lot of things like that where the law assumes that you can separate them out. And it's well, if you hear about the 4 other times where they were convicted of lewd behavior, you're not using that to say that they're the kind of person who does that. You're using it to say it wasn't an accident. It's well, they're one and the same in this case. To say that someone didn't do it accidentally is to say they did it with the wrong kind of mental state, and that they did it, right? Because you don't, the act and the mental state are one and the same. It's not a misconception necessarily about neuroscience. It's just the law is being very ignorant and stuck in the kind of 1500s Cartesian dualism view. This comes up a lot, where we see it in the evidence rules that really discredit emotional evidence. And it's even referenced in this Rule 403 that says you're not supposed to rely on overtly emotional evidence, because reason is what you're supposed to rely on. And like you were talking about with Kahneman's research, people make irrational decisions based on emotion, and sometimes they would even do it again. They don't necessarily think that's the wrong decision. But the law completely ignores the role of emotion, because that's considered to be part of the body, and the body is not as reliable as the brain. And obviously there's a whole history of sexism and racism associated that with Plato and many, many philosophers, Kant, saying that, and obviously Descartes, reason is a male thing. It's something for the white privileged classes. Women and the kind of inferior races are the ones who engage in all this passionate, emotional thinking. And so we really want to deprioritize emotion and elevate reason. But in a ton of cases, emotion actually has probative value. It tells you something. This witness is afraid. The reason why they're afraid tells you a lot about maybe they're being harassed. Maybe someone has told them not to testify because they're, a drug lord and they don't want this person to be testifying against them. So I just think that's probably the biggest flaw in the law that's just a failure to consider that we maybe need to update our 1500s thinking about the brain and the body being separate and mental states and behavior being totally separate.
Well, in the law, old habits die hard.
It's
hard.
True.
For sure. For sure. And in neuroscience, you never die.
Well,
to close this off and looking ahead, where do you see the most productive dialogue between law and neuroscience that may emerge in the hopefully near future?
Yeah, so I think there is so much interesting work to be done between neuroscientists and lawyers. I'm on a project with Corey Inman at the University of Utah, and we're looking at how memories are formed in the brain using people with brain implants and looking at EEG data to see how memories are instantiated and formed with the hope of, in the future, helping people restore their memories or helping them with memory loss. And it's very early days stuff, but they're already finding that just from EEG data alone, they can tell when someone is lost. They can tell when they see a face they recognize. They can tell when they've turned a corner at a museum or, an outside space. So, this is all obviously for in terms of like legal applications or even clinical applications, it's really far off. But I think that kind of stuff is incredibly exciting. And there are a lot of legal issues there around privacy and forced explantation. Let's say the company goes bankrupt. Well, now you have this product in your brain. It's very unlike other kinds of products where you just stop using it, right? So lots of cool and interesting legal questions there. But I think in general, neuroscience and law is going to have the most productive marriage if they involve more social psychologists, because there really is this bridge between the two. I've been saying this for, decades, but I still think it's true that a lot of the coolest work being done really is social psychology and law. And the neuroscience kind of provides some mechanistic data that's interesting, but we really still need the social psychology to explain the behavior, because the brain imaging or the lesion or whatever is potentially useful, but if you don't connect that to some sort of behavior, then it's not that relevant to the law.
Teneille, thank you so much for opening up our 5th season and help us think through the mass interactions of law, biology, and the mind, and remind us that sometimes, the gray areas are where the real insights live. Thank you so much. Thank you, Colin.
Absolutely.
Thank you again, Teneille. This was really a lot of fun, as you predicted. I'm going to echo Gustavo and say thank you for opening up our 5th season.
This was delightful. Thank you, Colin and Gustavo. I had a great time.
Thank you, listeners, for staying with us, and we'll catch you on the next episode of Lobes and Robes.
Thank you for listening to Lobes and Robes, How Neuroscience Can Change the World. This podcast is produced as a partnership between American University's Center for Neuroscience and Behavior and the Washington College of Law. If you'd like to reach us, you can email lobesandrobes@american.edu. You can also find us on LinkedIn, Instagram, and YouTube for updates and additional content. If you enjoy the show, please consider subscribing and sharing it with others. We look forward to having you with us the next time.
This podcast was edited by Resonate Recordings.